I would like to take a moment now to briefly update on the latest advice on the Pfizer-BioNTech vaccine, which we approved in early December. So the next slide, please, summarises the updated guidance on the use of the Pfizer-BioNTech vaccine, particularly in pregnancy and women who are breastfeeding, in people with allergies, and also on the dose interval. Taking first pregnancy and women who are breastfeeding. Our advice to date has been that given that in initial lack of evidence on a precautionary basis, use of the vaccine wasn't recommended in pregnancy, and women with breastfeeding should not be given the vaccine. But now that we have reviewed further data that has become available, the Commission on Human Medicines has advised that the vaccine can be considered for use in pregnancy when the potential benefits outweigh the risks, following an individual discussion with every woman. And as the COVID-19 vaccine AstraZeneca is the same, women should always be discussing benefits and risks of having the vaccine with their health professional, reaching a decision together based on individual circumstances. And women who are breastfeeding can now also be given the vaccine, subject to that individual discussion. Turning to people with allergies. We previously issued advice that people with a range of allergies to food, to vaccines, to other medicines should not be given the Pfizer-BioNTech vaccine. But there is now growing evidence in a much wider pool of people who've had the vaccine, at least 800,000 in the UK, probably 1.5 million in the USA, which has raised no additional concerns and gives us further assurance that the risk of anaphylaxis can be managed through standard clinical guidance and an observation period following vaccination of at least 15 minutes. And so the Commission on Human Medicines has now advised that anyone with allergy to food or other medicine or vaccine can have the Pfizer-BioNTech vaccine. Of course, anyone with a history of allergic reaction to this vaccine or its ingredients should not. Finally, the dose interval. The Commission on Human Medicines, on further review of the data, has recommended that the second dose is at least 21 days after the first. So this allows for a potentially longer interval compared with the previous advice that was 21 days. And the conditions for use of the Pfizer-BioNTech vaccine stress that this is in accordance with national guidance. So those are the updates on the Pfizer-BioNTech COVID-19 vaccine. They mean that even more people are now eligible for vaccination.